Welcome. My name is Karen Creed, and I'm lead midwife for genomics in Central and South. And I'm here today with Rachel. Rachel, would you like to introduce yourself?
Hi, I'm Rachel, and I'm the Regional Results Coordinator for Central and South, based at the Birmingham Women's Hospital, but also covering other hospitals within the Central and South.
Thank you. So the overall aim of this webinar is to give you an overview of the Generation Study, which, as you'll hear, is one of the biggest research programs in genomics since 100,000 Genome Project. Now, what we're finding is results are starting to come through from this study, and we're starting to identify babies with rare genetic conditions. And what we're finding is that when we're going into sort of paediatric services to deliver these results, that while some of the consultants and senior clinicians are aware of this study, because we've had conversations with them, that perhaps some of the nursing teams and sort of other allied health professionals perhaps haven't heard of it or aren't aware of it. So we've put this webinar on aimed at anyone working in neonatal paediatric services, whether you're a doctor, nurse, midwife, allied health professional, and it's really aimed at our recruiting sites in Central and South. But if you're from outside of that area, you're very welcome. It's just we might not be able to answer any questions about whether studies going on in your hospital. So what we want to cover in the next half an hour is just give you an overview of the aims of the study, what conditions we're screening for, what we're not screening for, explain the difference between the Generation Study and the current NHS newborn blood spot screening program. We'll very briefly look at how we're recruiting to the study and how it works in practice, and then we're going to focus in a little bit more detail on the results and where sort of paediatrics fits into that. And at the very end, I've just got one slide on where we are in terms of implementing the study, both locally and nationally. So why the Generation Study? Why now? Well, advances in technology mean that whole genome sequencing is possible at scale, at speed, and at lower cost than it has been in the past. And when I talk about whole genome sequencing, what we're talking about is sequencing the entire DNA or the entire genome of a person, which we can then analyze to look for those tiny genetic variations or genetic changes that could cause a genetic condition in that person. That's a very simplified view of whole genome sequencing. Now, there are lots of examples of how we use this technology across the NHS to help patients. And here's just one example with the story of Owen. Owen is now 9 years old. When he was born, he was fine, but then shortly after birth, he started developing various health challenges. And despite lots of interventions and tests in the early years, it wasn't possible to understand what was causing these problems. Obviously, it was of great concern to his parents. It was difficult for Owen, and it was baffling to the hospital specialists that he saw. But then he participated in the 100,000 Genome Project, and that identified a rare genetic change that meant his body did not respond to thyroid hormones. Owen now receives daily thyroxine and is making good progress. One of the things his parents said after that was, imagine if we'd been able to diagnose this condition shortly after birth and start treatment earlier. Would that have made a difference? And certainly it would have stopped all those sort of repeated tests and going in and out of hospital and got a diagnosis sooner. It might have improved the outlook for him. And of course, it may have been cost saving for the NHS as well to get that diagnosis sooner. So that's where the Generation Study comes in. So what is it? Well, it's an HRA-approved research programme. It's led by Genomics England in conjunction with NHS England. And what we're aiming to do is sequence whole genomes of 100,000 newborn babies to look for some of the 9 children born every day in the UK with a rare but treatable genetic disease. And what we're expecting during the course of the study is to find about 1,000 babies with a condition suspected result. Now, this is a screening programme. It's not diagnostic. So any baby with a condition suspected result will then go on and have further testing to confirm the diagnosis in that baby. And that's what Rachel's going to talk about in a little bit more detail later on. So generally speaking, the overall goal of the Generation Study really is to develop evidence for policymakers to decide whether whole genome sequencing should be offered as a screening test to all children at birth on the NHS in the future. And if so, how do we do that? And in order to answer that question, there are three main areas of focus. The first one I've already touched upon really. It's about evaluating the utility and feasibility of using whole genome sequencing as a screening test for a large number of rare genetic conditions. And of course, we've not used whole genome sequencing as a screening test in this way at scale before. If you think about it at the moment, if we're doing whole genome sequencing, then it's generally because we've got a patient in front of us that's got a collection of features or symptoms that we want to find a diagnosis for. So we use it for diagnosis. When we're using it as a screening test, we're starting off with a healthy asymptomatic baby. So we don't really know how well whole genome sequencing is going to perform when used as a screening test at the moment. Secondly, we're going to store all the genomes of the babies in the National Genomic Research Library, and that will enable researchers to access that data, and it will hopefully contribute towards improving our understanding of rare disease and hopefully develop new treatments and diagnostic tests for patients in the future. And then finally, we're going to explore those longer term implications of storing a baby's genome over the course of their lifetime. And when these children reach age 16, we're going to approach them and ask if they want their data to remain in the study. Obviously, parents, once they've consented, can withdraw at any point in the study and have their baby's data removed from the study if that's what they want to do. But when the children are 16, we'll be asking them themselves because they will have capacity at that point to make their own decisions. So what are we going to be looking for? Well, we're going to be screening for over 200 conditions caused by changes in over 500 different genes. And we've got a curated list of conditions that we're going to be looking for. And if you want to look and see what conditions are included, then there is a list on Genomics England website. If you Google Genomics England Newborn Genomes Programme, the conditions list will come up. But in order to make it onto that list, then the conditions had to meet certain criteria. They had to be early onset, so appear in the first 4 to 5 years of child's life. They had to be conditions where if we find them early enough, we can improve them, the outcome. And they have to be conditions where we've got a treatment and that treatment is available on the NHS. So what we're not looking for are variants of unknown significance. We're not looking for carriers. We are not looking or reporting later childhood onset conditions or adult onset conditions. We're also not reporting predictive variants. So, for example, variations within the BRCA genes can increase the risk of cancer later in life. We're not obviously looking for those or reporting those. We're just focusing on those early onset, rare childhood conditions where we know that treatment can make a difference. So it's worth at this point just pointing out the difference between the current NHS newborn blood spot screening programme and the generation study. So many of you on this call will be aware that newborn blood spot screening is performed on day 5 of life. That usually takes place in midwifery care, but sometimes in neonatal and paediatric units. They will also do the test if they've got very young babies. We screen for up to 10 different conditions, and the list of conditions are on this slide here. We actually screen for all of these conditions in the generation study. And one of the things that we're concerned about is that people might think that because the generation study also screens for these 10 conditions and another 190 or so in addition, and it's genomics, people might think that the generation study is better than newborn blood spot screening. But we have to be very clear that newborn blood spot screening is the most important screening test. It's the gold standard of care in the NHS. It's of proven clinical benefit. We know it saves lives and reduces morbidity on a daily basis. And it's really important that all our babies who take part in the generation study also have newborn blood spot screening. Several reasons for this. Firstly, the results with newborn blood spot screening are turned around very quickly. So we generally get the result back within 2 weeks and then on treatment within 3 weeks, which is important for some of these conditions where a diagnosis is time critical. With the generation study, we know that results at the moment are taking considerably longer than that, in some cases several months. And also, we look at things very differently on newborn blood spot screening. So we're looking for biochemical markers in the blood that might be present because the baby's got a genetic condition. So we may pick up conditions that do not have a genetic cause. And a really good example of that is congenital hypothyroidism, or CHT for short. So CHT doesn't always have a genetic cause. So if we have a baby that has the generation study and not newborn blood spot screening, we might miss a case of CHT, which would be devastating for that baby. So it's really important to emphasize that all babies in the generation study should also have newborn blood spot screening. So really the generation study should be seen as additional to the newborn blood spot screening program, and it certainly doesn't replace it. So let's just have a look at how the study works in practice. So in order to be eligible, you need to be pregnant and over the age of 16, and that's just so that you've got capacity to make a decision about whether you want to participate or not. You need to have an NHS number and be registered with a GP in England, and that's all about the fact that we need to be able to track babies and families after they've taken part in the study. At the moment, it's only available to women who are pregnant with one baby. If you are having a twin or triplet pregnancy or more, then you cannot take part at the moment. And you must be planning to keep your baby. So if you're giving your baby up for adoption or you're acting as a surrogate, you wouldn't be able to take part. We're approaching parents at various touch points during the pregnancy to give them information about the study. So we have information leaflets, we have a video, we have a website, and parents that having had that initial information, if they want to have a further conversation, they can register on a web portal, and one of the researchers will contact them, or they can approach the research team direct. And then there will be one or more consent conversations where parents can explore all different aspects of the study and then make a decision about whether they want to take part or not. And obviously it's quite a complex study with a lot of factors to think about. So these consent conversations can take quite a long time to go through, and it's very important that parents consider all aspects of the study. If they consent to take part, then we will take a cord blood sample shortly after the birth, and then parents will receive a result a few months later, and we'll come on to that shortly. The sample will then be stored and the data stored in the research library, as I've indicated, and then parents will get ongoing contact about the study in the future. So before we focus on the results, I just wanted to mention a little bit about equality and diversity within our recruitment strategy for this study. It's important that we ensure that everyone has equal opportunity to take part at our recruiting sites. This is important for any research, but particularly in genomic research. You'll probably be aware that some conditions are more prevalent amongst people whose families originate from certain parts of the world. Yeah. So a really good example of this would be sickle cell disease, which is obviously more prevalent amongst people with ancestry that originates from certain parts of Africa. Something like cystic fibrosis is more common in people with ancestry from Northern Europe. So if we do genomic research on just certain groups of the population or people with certain ancestries, we will end up knowing a lot about the kind of genetic conditions that are prevalent in those groups. But for other groups of people who perhaps traditionally are less likely to take part in research, they may be at risk of getting left behind in terms of genomic medicine going forwards. So it's really important that we focus on who our underserved groups are and how best to facilitate their inclusion in the study. We don't want to encourage people to take part, but we want to encourage people to consider whether taking part is right for them. And in order for people to be able to make that decision, then of course we have to make sure that they hear about the study and get equal opportunity to participate. Because of that, we're doing a lot of engagement work with our communities at our recruiting sites to try and understand some of the barriers and blockers about why people might want to take part or might not want to take part, and try and facilitate inclusive recruitment. And if you're aware of any groups in your community that might want further information, any groups where we can come and talk to them, we're happy to come and talk to them. Please get in contact with me afterwards. So we're just going to now have a look at the results. So results fall into one of three categories. Most babies are going to get a condition not suspected result. And we think about 99% of babies will get one of these results. The parents will be informed by an email or letter a few months after birth, and their GP will be copied into it as well. That will include information about what to expect going forward as a participant in the study. It will also emphasise that a no condition suspected result doesn't mean this baby has a clean bill of health, and if they are concerned about their baby's health, they absolutely should contact their GP or health professional to follow that up. Secondly, we might get a no result returned, and that might be for technical reasons in the lab, where for whatever reason we can't process the sample. For those babies, they are then excluded from the study. There isn't an opportunity to go and take another sample later on, so they will be excluded from the study going forward. And then the group that we're probably most interested in today are our condition suspected babies. And like I said, we think about 1% of babies will fall into this category, and they will be contacted by an NHS specialist. And my colleague who's on the call today, Rachel, is responsible for coordinating the delivery of those results to parents. So what I'm going to do now is hand over to Rachel, and she will talk to us in more detail about the process to deliver these results to parents.
Hi, I'm just going to take control of the share of the slides as well. So once a condition suspected result has been released from Genomics England, it will come through, they'll phone me first and it will come through to our email box. Before the study started, there were a number of clinicians that took responsibility for the conditions to be linked to. So every condition that has been chosen to be in the generation study has a lead clinician and a secondary clinician, so that in order when a result comes through, they are already aware that they will be taking those babies onto their caseload. And what's going to be slightly different is these are more likely going to be well babies rather than babies that have presented at the GP with an illness and been referred on for additional testing and then referred into these clinicians. So it might be within these practices, we're seeing babies that are completely well, that have no symptoms. So what happens is the healthcare professional who is responsible for contacting the parents for a suspected condition, what we've realised is, although that these consultants have agreed to take this caseload on, they're not always the first person to contact the patient to come in. So where you have like specialist nurses and people working in these teams, they may be the first person to contact the parents, and they'll need to tell them that they have had a suspected condition arise from the generation study. And they may have signed up to the generation study 20 weeks ago in their pregnancy and need a bit of a rejig of a memory of what they've actually signed up to. So the result will be delivered to the NHS specialist, and I will be there to support you. So I will be there throughout the whole process. If you need to contact me at all with any information, I'm more than happy to support you. The condition suspected result, again, is not diagnostic. And where we need you is because in order to get a completion of this, we need a diagnostic outcome to link with the suspected condition. So the purpose of the study is not only to obviously pick up these suspected conditions, but we need a diagnostic outcome. So obviously sometimes we get false positives, and we need to either exclude or confirm these findings of these children that are being referred to these specialists. So a pack has already been created, which will include a genomic research report, which will tell you which gene difference that has been identified on the child that is going to be in question. There'll be a sheet with patient contact information. It will have their name, their NHS number, their date of birth, the NHS number of the child, and a contact telephone number. If you need to refer back to me for any of those details, you can do. There is a result call guideline available in this pack, but this is only a guideline because we are not the experts in these particular specialists. It's you, the people that are going to be delivering the results. So it is just a guideline. There's a template for a results follow-up email to the parents, and and an information sheet which can be sent to them, a patient-facing condition information sheet which can be sent to them afterwards. Within the email, there's a link to the diagnostic outcome form, the DOF. If this patient is seen by one of these clinicians and the diagnostic outcome form is not returned, we will be there to remind you to hopefully return the information, because it's the most important part of the study to see, is this study working in practice? Okay, I'm just going to give you a little example here of what this is, like a blank report of what it looks like. So it has the Generation Study Genomic Research Report. It says that it's from Genomics England. It has the patient's name and date of birth, NHS number, and it will say what the genes difference is, and it will have information about the test pathway. Okay. When you review the result pack and you've contacted the parents, we'll arrange a follow-up call with you to see how it's gone, and if you need any further support, and how long you would expect that diagnostic test to take before it will come back. Sorry. In the diagnostic outcome, it's really important for us to understand whether the baby has received a diagnostic. I think I can't reiterate that enough, really. Originally, we would send it after the baby had been seen, but it now has become part of the initial pack, which goes out to the specialists. But it's not always remembered to be filled out once you see the baby in the clinic. So please don't be offended if you get follow-up emails asking for that, or if you need any help or guidance with it, more than happy to help you. Okay.
Thanks, Rachel. So our last slide really is just giving you an update on where we are in terms of implementing the Generation Study. We first started recruiting back in March 2024, and currently there are 20 sites live recruiting at 19 trusts across England. And we're aiming to implement at 35 to 40 trusts across the country, and hopefully we will be at full complement by the end of the summer. So far nationally, this data is actually from last week, so already out of date, but we've recruited probably over 9,000 families by now, and over 4,000 samples have been taken. So far, 25 condition suspected results have been returned nationally. We can't talk about those in any more detail because it's very early days in the study and the numbers are so small we could risk identifying who those families are. Also, it's early, so these families need time to get start processing the results that they've been given. So obviously very difficult time for those families. The study is going to continue up until the end of December 2026 in terms of recruiting, and then we've got funding to support the return of results up until the end of March 2027, and this funding has been confirmed by the Department of Health. So myself and Rachel, we work in Central and South, and Central and South geography doesn't match anything in NHS England. This is genomic geography, which is different to NHSE geography, but we cover West Midlands, Thames Valley and Wessex, and we have sites live in the West Midlands. So we're recruiting at Birmingham Women's Hospital and University Hospitals Birmingham at the moment. We're also recruiting at Oxford, and we're working with Milton Keynes and Southampton to set up to start recruiting there as well going forwards. We have a regional results coordinator who is Rachel in the West Midlands, and we've also got regional results coordinator to help process the results in Thames Valley, and we'll be replicating the same in Wessex. We're doing very well with recruitment in Central and South. We've recruited almost 2,000 and taken over 1,000 samples, so it's all going well from our perspective. I think we're still a long way off reaching that target of 100,000 nationally, but obviously as we get more updates at some point in the future we will be able to start talking about some of the findings, and we will there will be sort of information on that coming out. So that's really all we wanted to talk about today, just to give you a very brief overview really of what the study is and the results process, so that if you have any parents coming through your care who've received a condition suspected result or a diagnosis following this study, then at least you will have heard of what the generation study is. And if you've got any questions, we'd be happy to answer them. Rachel, can you just turn the slides off? Yeah, so thank you. So if you've got any questions, please pop them in the chat or put your hand up. Alternatively, you can contact us afterwards. Actually, Rachel, if you go on to the next slide, yeah, I've just got my email address there. So if anyone's got any questions and wants to contact me, they can. If you want to find out more about the study, you can log on to the website. For the generation study. There's a QR code there as well, and I've just put some other resources on this slide as well if you're interested to find out more. So we'll be happy to answer any questions. Either put them in the chat or put your hand up, and we'll stay online until past if there's any questions.